JC. I'm the office manager. I am not new to our community. I've been here most of my life, so I know a lot of faces that are in here. Yeah.
I'm the regional manager, so I kind of cover South Nashville between here and Murfreesboro. And thank you everyone for coming. I'm going to take this opportunity to plug that we are doing a day of service, free care for veterans on the 7th. Is that right? On the 7th. So if you know veterans, or if you are a veteran, you know folks who have served, please encourage them to come in, free exam. Anything that we can do that day for free, we will do for free. And thank you, Doc, for being so generous to be donating that care. But again, thanks everyone for being here. We're really excited to get to know more people. If you can sit.
I'm Tara, and I work here at the front desk. Nice to meet everyone.
I'm Catlin. I'm a dental assistant. I've been with Dr. Hussein for the past 5 years in Columbia.
I'm Aubrey. I'm a dental assistant. I worked at the Columbia office for a couple of years a year ago, and I came back.
I'm Cindy, and I'm excited to be here, and I live in Spring, right down the street.
Nice.
No, I don't work there.
As we go through the tour, it's kind of helpful to say this is what a patient experiences when they're going through this process. So a patient calls, they get an appointment, and we set an expectation right away that we do comprehensive dentistry. So basically what that means is ideally we're going to take a look at every tooth in your mouth. You might have one thing that's bothering you, one thing that kind of led you to be in pain, pick up the phone and call the dentist, but we do want to try to look at everything if we can. And we know that that process can be overwhelming, so our whole mission as a company from the top down is to make it easier, just simply easier on the patient. So we explain it, and then hopefully throughout this process you see how it becomes easy. They check in at the front, we kind of let the team in the back obviously know that they're here, and then the patient will come this way, kind of tell their story to the dental assistant. About 18 x-rays on you on your first visit, unless you like recently had to take it or something like that. That's something that is supposed to be done anytime you establish yourself as a patient in a new dental office. So everything we do is super textbook. The truth is we are a large dental organization. That means that everything we do has to be perfect and by the book. So if I'm in your shoes as a patient, I'm saying I'm actually glad that I know that you folks have to adhere to a pretty high standard because we're from California to New York. So there's an aspect of that that is really, really good for patient care.